Welcome to True Health Tuesday. Now, isn't that better than saying, excuse me, we're going to start now? The truth will set you free. Okay, hormones and women's health. We've talked about hormones this whole month. Today, and you could talk about a number of specific conditions, but if you look at it as a communication issue, because a lot of people say, well, it's at menopause. I got 3 sisters, okay? They've all gone through it, and you know what they were doing when they hit menopause? No more menstrual cycle! They were so happy, it was like totally cool. But they're normal, okay? They don't do a lot of drugs. Well, I mean, not the prescriptions. So when you look at this, Lila, Lori, and Lanny, I love you guys. Michael Borkin. Okay, female hormones, it can be an adolescent, menopause, before birth, because what are hormone issues? You've got 2 things that are responsible for communication. You've got the sympathetic and parasympathetic nervous system, the autonomic nervous system. Then you have the entire hormonal system. And so the body is designed to be healthy. So why isn't it? I mean, when you talk about women's health and hormones, what are women suffering from? And could this be bad luck, bad genes, or poor communication? So we're going to go through what women are experiencing now in the health and the decline and why they have higher disease rates and the source of that. Now, when you look at menstrual irregularities, can you imagine any animal species on the planet where the 50% of their population every 28 days would have a difficult menstrual cycle where they couldn't run away from the attackers? No, it doesn't make any sense. And so what we'll do, if I look at a patient during a regular exam, if they're under chronic pain, that means they're in a sympathetic dominant state. So they're going to have a hormonal imbalance from stress. But if you're exposed to endocrine disruptors, things that interrupt that communication from the hormone producing organs and their effect, you are going to have irregular menstrual cycles. Now, in completely crazy, ignorant world, if you have, say, a 13 or 14-year-old kid that has a menstrual cycle, which is a bit on the early side, although we're seeing it all the time, they're given a synthetic hormone called estrogen or birth control in order to balance out their menstrual cycles, totally discounting what that could affect them when they grow older. When we're looking at urinary tract problems, incontinence, that's a lack of communication between the pelvic area and the brain. It's the same thing as enuresis or bedwetting. If that pelvic floor is destabilized. So if you know this, shouldn't we look at the stability of the pelvis? When we look at pelvic floor disorders, vaginosis, uterine fibroids. A fibroid, is this something that just bad luck or bad genes hit? Or is it an intelligent response by the body to wall off pathogens or to wall off toxins? And I'll tell you, that's what it is. When you look at polycystic ovary syndrome, this is, poly means many, ovary, and syndrome means they really don't know what causes it, which is either criminal negligence or ignorance, because we know it's from toxic endocrine disruptors in the environment that cause this. It's literally in the fast food. We've had, hundreds of patients with polycystic ovary syndrome, and we say, look, you can't eat any commercially produced animals. You got to go on a completely organic, plant-based diet. You're going to be a vegetarian for a while. And they'll go, no, my doctor says that food doesn't have anything to do with it. Okay, yeah, your doctor's wrong. Because they're trained, in this entire culture, we're trained with symptom therapy. And not even that. It's categorizing of a group of symptoms and then the therapies, which are the same for everyone. Endometriosis, that's pelvic instability. That means that the body has unstable structures. When you look at the cancers, breast cancer, ovarian, cervical cancer, are the cancers just happening in our population knowing that 1 in 2 will get it? 1 in 2? 50%? Does that sound like it's a gene thing or it's an environmental toxin thing? And so, and we're talking just 30, 40 years ago, people were trying to not get pregnant. Now we have fertility problems everywhere. There's fertility. So this is generational. So we're going to go through some of the most common disorders, and you're going to find out that they're not even disorders. They're actually a miscommunication. Thyroid disorders. Have you seen this picture before? Okay, now I know the print's small, but when you look at this, anything you put on your skin gets in your body. Now, they're listing shampoo, eyeshadow, lipstick. They say the average woman, of course, now you got to remember, my mom, 40s glamour girl, she called me up in panic one day, and this was when she was in her 80s. Come over right now. And it was like, okay, Mom, what's going on? Just, you got to come over. Okay, Mom. You know, her makeup light was out. And she wanted to go out with friends, and she couldn't put her face on. And that was, did anyone's mom ever say, I got to put my face on? Okay, that's literally, okay, the thing, what they were doing. But this isn't pomegranate juice they're putting on their lips like Cleopatra. Okay, so a lot of these, nail varnish, perfuming, fake tan. And if you look at the effects of this, you're talking fertility problems, cancer-causing agents, okay, endocrine disruptors. Anything that you put on your skin gets in your body. Now, this is just the makeup, shampoo, skin products, everything else that's completely toxic. Endocrine disruptors. If you look at endocrine disruptors, has the key factor in how we're developing the diseases, but that's not even the important aspect. We have a body that's designed to adapt on this environment, and it does that through communication pathways, the nervous system and hormonal system. Anything that disrupts that communication is going to have an alternate effect. Okay, instead of just dealing with a toxin, you're going to develop tumors and cysts. So these things that interrupt that communication are called endocrine disruptors. Does that make sense so far? Okay, so they mimic hormones. They're similar to them. Or they're a toxic product that alters the structure and the function of that organ system. They can bind to certain hormones, they can accumulate in hormone-producing glands, interfere with some hormones, increase or decrease the production. Now, where are these endocrine disruptors coming from? Well, I mean, we got vaccines, pharmaceutical products, hair care products, flame retardants, carpet. Like that new car smell? Endocrine disruptors, okay? And it's so, it's pervasive, it's everywhere. And no one is talking about, wow, you know, you've got breast cancer on the upper left quadrant, which is where 80% of them are. You know, you must have some leaky gut or digestion because that's where the gut drains to the upper left quadrant. You know, you must have some type of toxic environmental exposure. Let's go through your history and find out what your diet's like. Why find out how many bowel movements a day do you have? Are you in this stress state? Why did you develop this? Does any doctor say that? Okay, aside from here. Okay, no. Bad luck or bad genes. You know, and this is the undercurrent. But if you look at the data points out there, the research, it's like, my God, we're just poisoning ourselves, and these diseases don't really exist. They're the end result of a long-term chronic poisoning. Endocrine disrupting chemicals, EDCs, Endocrine Review 2009. Observation of uncommon vaginal adenocarcinomas in daughters born 15 to 22 years earlier with women treated with the very first estrogen, DES. Now, this was discovered in 1938. We know that it was passed out from 1940 to 1971. First estrogen, brand new, great. It's going to be amazing. We're going to interrupt that communication because the doctor's way smarter in your body. Oh my gosh. Arrogance, ignorance. Anyone familiar with the Tower of Babel? Nimrod? Yeah, I'm better than you, God. Really? Really? Arrogant little... Okay, so when you look at this, we have that same arrogance where the doctor is smarter than your own physiology, and he's interrupting the communication. So this estrogen that was passed out, and it was designed to prevent miscarriages, help with pregnancy, help with preterm labor, and it found out it didn't do any of that. Okay, but it was still passed out for 30 to 40 years. We see the daughters of them affected by this. The reason I'm bringing this up is because right now, everybody here is exposed to endocrine disrupting chemicals. Whether you're of childbearing age or not, you're exposed to it. Now, this is absolute evidence of women that were isolated. They took this drug. Okay, it didn't really work in the first place, but it affected their generation. It affected their kids' kids, and it affected the third generation. So what is going to happen to our population? A question was posed to me earlier. What's going to happen to us now with our food supply that's toxic, with our medications that are poisonous, with our medical system, which is completely, totally dysfunctional? I mean, the right drug at the right time in the right dosage kills 130,000 people a year. Medical care is the third leading cause of death. The Harvard and New England Medical Journal say there's an inverse relationship to the amount of money you spend on this type of psychotic care. Why? Because what do you do when you go to the doctor? They categorize you, they look at your symptoms, they check your vital signs, and they just changed blood pressure again, the number, okay? So they check your vital signs, and they don't ask you how you're pooping, how you're thinking, or how beautiful your cell phone tone is. I thought it was pretty. I thought it was okay, don't worry. No one's gonna stare at you at all. So when you look at this, the doctors aren't really doing detective work or saying what it is. They're just getting your symptoms, and then they're going to give you a chemical which alters your communication. This is why all pharmaceutical products are endocrine disruptors. They alter your communication. They either block a receptor site in a cell, which is going to alter that cell communication, or they poison an enzyme, which is going to alter that communication. So all of this stuff is disrupting or usurping the natural adaptive physiologic response that you have to the environment. 3 generations, what do you think is going to happen to us? 100% of the people coming in between 18 and 25 now, I'm asking them, are you fully vaccinated or no shots whatsoever? Because if they are, they're in an experiment. They've had 69 doses of 16 different vaccines. Then I'll ask them if they had ear infections. That means multiple courses of antibiotics and a birth trauma. Did your mom have Pitocin? Look, I'm 25, I didn't know, okay? Well, if your mom had Pitocin, this means you have a 60% increased risk of those neurotoxins that you're getting injected to have a negative effect on your body. And so it's like I got an entire generation of people coming in that 20 years ago weren't like this. And so let's just look at bromine, okay, just for the heck of it. Thyroid's a big deal. A lot of people are misdiagnosed with thyroid issues. And did I say diagnosed or misdiagnosed? Misdiagnosed with thyroid issues, because what is it? It's an endocrine producing organ, okay, and the doctor says, well, it should be up this high, and we've got the pituitary telling the thyroid to work harder. So if the pituitary is screaming and the thyroid's down, you got hypothyroid. If the pituitary is not sending out thyroid stimulating hormone and the T3 and T4 is high, then you've got a hyperthyroid. Now, no one's talking about the hypothalamus, which is the main organ that's got 1 foot in the nervous system, 1 foot in the hormonal system, and the hypothalamus is the main controller. So what's causing the thyroid to malfunction? Well, the thyroid needs certain products. It needs raw materials to produce what it produces, okay? Now, if you're deficient in those nutrients or nutrient deficient, because we're talking about most diseases in almost every talk I've ever given, that diseases are from toxicity or deficiency. Let's just take iodine. Has a deficiency. I mean, you should take iodine anyway, but let's just take it as a deficiency. So it's in the little periodic table of elements called the halides, okay? You got chlorine, fluorine, bromine, okay, iodine. Okay, now if you're deficient in iodine, okay, now I'm going to walk you through this because this is going to be like ridiculously simple. If you're deficient in iodine, which is similar, it's a halide, but you have a huge amount of toxic exposure to chlorinated water, fluorinated water, or brominated beverages, or bromine in the environment, then guess what's going to happen? Your thyroid's going to try and build stuff out of this. It can't. It's going to swell. You get goiters. You're going to have all of this stuff going on. So let's just look at bromine. It's an endocrine disruptor. What does that mean? It's disrupting the communication or your body's adaptability based on this chemical assault. Pesticides, plastic, baked goods. This is why when you go to those fancy stores, what are they advertising now? No brominated flour. It's amazing. Okay, but what do they have in the majority of markets? No signs like that. Soft drinks, Mountain Dew, Gatorade. Okay, why? Because these have brominated vegetable oils. Do you think these kids drinking this stuff have tons of healthy supplements and they're all eating seaweed, at least an ounce a day? Medications, okay, so we're talking asthma inhalers, stomach ulcer medications, anesthesia agent. The new car smell is full of bromine. Now, this was replaced in the 80s, so they used to use iodine has an agent in baking bread. And it was amazing, but they switched to bromine because, I don't know, they wanted an endocrine disrupting carcinogen that was inside the baked products because iodine was too efficient and the body needs it. I don't know why they used it, okay, why they switched. They build up in your tissues, it can't breaks down. So now let's say that you have this toxic substance in a body that's deficient in nutrients. Now remember, we're talking about women's health and hormones, but there's so many different, you're talking 87,000 different chemicals that are in your food supply, in your chemicals, in your skin creams, in your suntan lotions, in all of this stuff. So we're not gonna go over all of those. We're just gonna pick one little thing so that you can expand it out. Now, what does iodine actually do? What does iodine actually do? Well, stabilizes metabolism, body weight, vital in brain function, vital in fertility, protects you from cancer, protects you from infections, protects you from viruses, parasites, anti-cancer. Cool stuff. Now, just for the heck of it, what if we didn't have iodine? What if we were exposed to an endocrine disrupting chemical, such as bromine, that took the place of this, so we didn't have the benefits of iodine? So that means that the physiology of this wouldn't take place. Would we have a population that is obese with belly, seat, and thigh weight distribution? Will we have an epidemic of Alzheimer's and dementia? Will we have fertility problems where people aren't getting fertile if they wanted to have kids? Would we have a population where 1 in 2 people have cancers? Would we have a population with lots of infections? Shingles. Go on, say it with me. Wow! By God! I thought Fox News was cool. No. So again, let's say, we're just going to concentrate on the thyroid. Okay, not much. Okay, so you're deficient, you get this one endocrine disruptor. What happens? Depression, heart disease, fibromyalgia, autoimmune conditions. Wow, you know? Irregular menstrual cycles, infertility, memory problems. So now what happens? Because we get people all the time talking about inflammation. Inflammation's bad, inflammation's bad. No, inflammation is a result of tissue damage. So now if somebody says, you know, I got that inflammation, how about if they say, you know, I got that tissue damage? Would that change the conversation? Well, you got tissue damage, you should repair it. Or you might even want to find out what's damaged in the tissue. That makes sense too. Now, cortisol is interesting. It's made out of cholesterol, which is made in the liver, about 80% of it. And in fact, it's one of those adrenal hormones where your body produces this. It's one of the greatest anti-inflammatories ever. But now we got this balance. Just like we got that balance of the nervous system, we got the adrenals on one side and the thyroid on the other. So there always has to be a balance. If one of them is suppressed, then the other one has to be active. Whoa! What if we didn't have iodine, we were exposed to toxic halides like fluoride, chlorine, bromine? That would negatively affect the thyroid. So wouldn't that mean that the adrenal glands or an adrenal dominant stress state or adrenal fatigue or low functioning thyroid and systemic inflammation, that all of this stuff would be all over our population? Wow. And it turns out cortisol deregulates female hormones such as estrogen. estrogen and progesterone are necessary for the female cycle. So people with menstrual cycle problems, are the doctors going in and saying, wow, you don't need the synthetic estrogen that could negatively affect the growth and cancer rates of your offspring and you for multiple generations. We need to check your diet and toxicity to make sure that you got sufficient amounts of iodine and you're limiting your toxic exposure. Wow. Isn't that cool? There's like a little glimpse in it when common sense comes back. But now cortisol is released under stress. Physical, chemical, and emotional stress, all are going to have the same response. And what kind of stressors are we under now? I mean, we've got the emotional stress. We've got the physical stress. We've got the chemical stress. And all of this is going to cause, because we're designed to live in a stressful environment. We're designed to run away from the predator. We're designed to survive in this. And so over millennia, our species has made it with healthy amounts of physical, chemical, and emotional stress. We need that. But now we're reaching a toxic overload. So let's just look at cancer. Knowing that 1 in 2 people are going to get it, we're just going to take breast cancer, because remember, we're talking about women's health and endocrine disruptors. Would endocrine disruptors have a factor in cancer? Well, let's just look at invasive and non-invasive. Okay, non-invasive cancers, ductal carcinoma in situ. Now, lobar carcinoma in situ, so these are non-invasive, and they used to be categorized as cancers. I'll show you they changed that definition. And then we have invasive ductal carcinoma. Now, when we look at invasive ductal carcinoma, the most common type of breast cancer, now let's look at it. Let's just look at the non-invasive ones first, the ductal carcinoma in situ. Now, before the popularity of mammograms, now I know what you're thinking, mammograms are now outlawed in Switzerland, okay? That mammograms are not recognized in a lot of parts of the world, but in this country they're forcing you to get them every year. And we know that mammograms actually damage the breast tissue, increase your rates of cancer, because it is damaging the breast tissue with radiation and compression. And they're very ineffective. The smallest thing that they can identify is about the size of a head of a pin, which means that it's been growing 9 years. So if you're going in there and you're following the doctor's recommendation and you get first mammogram, then second mammogram, then third mammogram, then 4th year, then 5th year, then 6th year, then 7th, 8th year, then 9th year. Oh man, we found one. Really? Okay, so before mammography, okay, 3% were detected. And then after, okay, a third of the screen detected cancers are for ductal carcinoma in situ. So now this is supposed to be, again, a benign lesion. However, or non-invasive. Now this was ductal carcinoma in situ, so you're talking breast removal, lumpectomy, radiation. So all of these things can cause damage to the tissue and secondary cancers. Now, a 25-year-long study on non-invasive, we're talking ductal carcinoma in situ, 25 years long, you do nothing if you have this, and 80% of them don't progress. 80% of them. So you have an 8 out of 10 chance that even if you have it, it doesn't progress. Now, this is, again, knowing that endocrine disruptors are responsible for this, not making any lifestyle changes, not changing your diet whatsoever, not changing your stress level whatsoever, 80% don't progress. And in fact, according to the Journal of the American Medical Association, the term cancer should be reserved for describing lesions that have a reasonable likelihood of lethal progression if left untreated. Anyone got a problem with that? Someone says you got cancer, I'm thinking, yeah, that's real bad, right? And this one won't. Pre-malignant conditions such as ductal carcinoma in situ should not be labeled as cancers nor neoplasia, nor should the word cancer be in the name. So ductal carcinoma in situ shouldn't be called ductal carcinoma in situ. Wow, how many women had their breast removed and damaged? So invasive cancers. Now this is the really bad ones. According to the New England Journal of Medicine, we believe that many invasive breast cancers detected by repeated mammography do not persist at the end of screening at the end of 6 years. So they find it 6 years later, it's not there. It's not there. And this is the invasive one. But wait a second. Suggesting that the natural course of many of the screen detective invasive breast cancers, the natural course of these cancers is to spontaneously regress. Now, if they've been looking at cancer for about 80 years and they haven't found the virus, the fungus, the bacteria, the pathogen, okay, that causes this, could it be that the tumors are actually intelligent, walling off toxins? Could it be that simple? Could it be a disease of metabolism or toxic environmental exposure? What do they use to treat this? Well, chemotherapy. Now, you may have heard that they had a study back in the early 90s that they asked oncologists in a private survey to say, hey, you know, you're an oncologist. If your family member had chemotherapy, would you give it to them? And 80% of the respondents said, no, I wouldn't do it. Okay, well, they ran it again in 2014. Same, again, private survey. It's now 88% of the oncologists wouldn't give it to their family members. The overall contribution of the cytotoxic chemotherapy 5-year survivals was around 2%. Okay, Australia and the US. And chemotherapy, aside from certain rare cancers, it's not possible to detect any sudden changes in death rates from any of the major cancers that could be credited to chemotherapy. Whether any of the common cancers can be cured with chemotherapy is yet to be established, so they don't know. Even mastectomy. If you have the BRCA gene and your aunt died of cancer and your cousins have died of cancer, that's scary. That's scary. Look at the environmental toxicology. Look at what they were exposed to. Because I guarantee you, your great-grandma never had it. Your great-great-grandmother never had it. You don't need to lop off healthy breast tissue. Nerve damage, lymphedema. I mean, we had another patient today. You know, her left arm was swollen like this, and she said, what do I do? What do I do? And I said, well, you know, was it breast cancer? Yes. And so you got to wear a sock. You can do whatever you can to compress that so that swelling doesn't cause, because it's going to cause pain. It's going to cause discomfort. But they're removing lymph nodes, even though that's part of your immune system. It's insane. According to the U.S. government, okay, chemotherapy is carcinogenic. And I even saw a commercial last year, this fireman holding this little bald kid's hand and said, little Billy got over, leukemia, but now he has bone cancer because the therapy caused it. Please send, for cancer research. Everyone should know that most cancer research is largely a fraud. Linus Pauling. The death rates, and Charles B. Simon, okay, now this, he says if you take the death rates from 1920, percentage of people that gets it, to now, it hasn't changed. It just doesn't make sense. I mean, when you look at the Lancet, obsession with the cure of advanced disease rather than prevention of early disease. It's gone up 300% in 32 years. 300%. Why? Is it bad luck or bad genes? The reason is we're just talking about women's health. We're just talking about endocrine disruptors. So if it really is environmental toxins, if these cancers don't really exist, they're just an adaptive physiologic response to environmental toxicities, to a maladaptive stress, cancer is a disease of metabolism. It's a metabolic disease. It's a poisoning. And sure enough, this is a brilliant book, Cancer is a Metabolic Disease, Thomas Seyfried. I encourage you to read this because it's going to blow your mind. No longer do you have to worry about your aunt or grandma or anything that had cancer, that you're in line for this cancer. You're not, okay? You're in line for the similar poisoning because of a similar environment and a similar background. So you can take charge of that and alter that expression of your genes. Age, viral, hypoxia, inflammation. So how many people with systemic inflammation? How many people with systemic tissue damage? How many people are exposed to tissues or tissue damaging factors like chlorine, fluoride? How many people are taking showers without a chlorinated filter? How many people are brushing their teeth or watering their vegetables with fluoridated water? I mean, it's mind-boggling that we have a mass poisoning of our population. And then you look at this. Cancer cells largely depend on glucose for metabolism, growth, and survival. When cancer cells do not have glucose to nourish them, they die. I got an idea. How about the #1 source of calories in America? Let's make it genetically modified high fructose corn syrup. Yeah, baby, pro-cancer, feed them. Is that dumb or dumb? I mean, it's like, my God. This can't be this insane. And I love this. This is brilliant. There is no magic pill for cancer. There isn't. If you have it, you can change it. You just stop what caused it. A new era will emerge for cancer management and prevention once cancer becomes recognized as a metabolic disease. So you go up there, they're not going to ask you about your family history. They're not going to ask about that. They're going to say, how many bowel movements a day do you have? Oh, 1 a day if you're lucky? Okay, you're in a sympathetic dominant state. How do you sleep? Oh, I sleep, I'm exhausted all the time. Really, do you get up at night to urinate? So that means interrupted sleep. Toxicity. Okay, what kind of medications are you taking? Oh, blood pressure and cholesterol. Were you taking birth control for 20 years because you didn't want to get pregnant? Oh, okay, so you got a synthetic estrogen that led to this? Can you see this? It's going to be more of an investigative procedure. Okay, wow, you've been toxic and deficient for 30 years. Now your body walled off these poisons and put it in your uterus or here. We're not just going to cut it out and radiate it. We're going to detox your system. We're going to get your body healthy. We're going to get your body working right. But first you got to understand how it works. If you think about something, you're walking down the street, okay, and you see this dark alley. I know, I want to go in it because I think it's exciting. But most normal people, they'll think, my God, is it safe or dangerous? And it's based on your perception. So the amygdala goes back in your memory, okay, and gets the emotional thing and says, wow, every time I've gone down a dark alley, it's been kind of dangerous. So that initiates the hypothalamus. Remember the hypothalamus? So anytime you perceive danger, like you go in there and you get your blood pressure taken by a guy in a white jacket, guess what? It's called white coat hypertension. It goes up. Okay? That's what the new guidelines are. The new guidelines, I'm reading this and I'm going, man, this is amazing. Okay? They're saying you got to take 10 minutes. They're saying you got to take 24 hours. Okay? You shouldn't do it in the office because it raises blood pressure. And I'm going, wow, this is brilliant. And then they looked at a 5-year-long studies because they went from 140/90 to being normal now to 130/80 to being normal. And they say, look, we couldn't find any difference in lowering it. We just thought it looked better. Honest to goodness, there's no data that says that this is appropriate. It just, they believe it's better. Okay, so anyway, so you got the amygdala that perceives the danger. It sends a signal to the hypothalamus. Hypothalamus has got that foot in nervous system, foot in the hormonal system. Then this sends a signal over to get that fight or flight or the rest and digest. Okay, so it stimulates those adrenal glands, the adrenal glands. And now this is under anything, physical, chemical, or emotional stress. This is how the body responds. So if somebody is presented with a chronic illness or disease, you don't attack the disease. You find out what the physical, chemical, or emotional stress loads are. Then you look at the adrenal glands. Oh my gosh, the adrenal glands produce every glucocorticosteroid, mineral corticosteroid, sex hormone, cortisol. They're amazing. So the liver starts cranking out some more cholesterol. Oh my gosh, your cholesterol is high. We need to find out what stress level you're under because your adrenal glands obviously need the raw materials. Why don't doctors say that? Why don't they say, wow, your cholesterol is high, you must have systemic inflammation or a stress response going on? No. They're smarter than your body. You need this cholesterol-lowering drug. Yes, I know cholesterol is associated, cholesterol drugs, with a 1,500% increase in breast cancer. I know that cholesterol drugs are associated with an increase in type 2 diabetes. I know it's associated with increased heart failure. I know it's associated with increased heart plaquing, but they give it to you because it's high. It's insane. So then we got the HPA axis, hypothalamus, pituitary, adrenal. So you look at this, and this is the hormonal system that's keeping you alive based on millennia of learning. So what happens? You got the cortisol that's going in here. It's mobilizing, it's converting amino acids. It's getting the glycogen broken down to glucose. It does all of these beautiful things. Except when you're under chronic stress, you get digestive issues. So how many people actually have inflammatory bowel disease because of bad luck or bad genes? None. You go in to the caribou in a herd of 10,000 and you have one with inflammatory bowel disease. Do you think it's bad luck or bad genes, or that thing got a hold of some shale oil? Or I don't know, what's some of the tundra? You know? Don't be licking the pipe. Okay, so you look at this and you think, wow, it's got to be environmental exposure. So why don't we look at human beings as the same way? You have ulcerative colitis. Wow, you had to have some type of long-term stress that decreased blood supply to the gut, that interrupt that communication, and your body is adapting. Wow, you got endometriosis. You must have an unstable pelvis. None of these are really diseases. They're maladaptive from chronic physical, chemical, or emotional stress. Excess cortisol, what are we looking at? Type 2 diabetes, elevations in blood pressure, joint damage because your body now has blood supply decreased to the gut. What happens with adrenal fatigue? Low depression, osteoporosis, inflammatory condition. I actually had a patient that said, should I take this drug for osteoporosis? And I said, well, let's look at that. Okay, it's called a biphosphate drug. You have cells that live on the bone that build up bone and cells that tear it down. And we need that build up and tear down process. Now it says on the label, if you take this longer than 5 years, you have an increase in fracture rates. Okay, I'm sorry, what was it for? I asked her. Oh, it's for thinning of bones. Okay, so if you take it beyond 5 years, you're going to have more fracture rates than if you didn't take it. Does this make sense, or does this sound crazy? And you know what she says? But my doctor recommended it. Wow. Okay, so I've done this 10,000 times, and I said, you know, your doctor can give me a call. Give her my card, and I will help her educate, about what osteoporosis is from, how it's from an acidic body, how it's from a toxic effect of the environment, how the bones are thinning because of physical, chemical, or emotional stress, and it's not from lack of biphosphate drugs. Okay? Not once have I gotten a call back. Berg, really? That's great, man. I didn't know that the body was self-healing or self-regulating, and osteoporosis wasn't a disease, that it was just an adaptive metabolic response to a toxic deficient environment. This is brilliant. I'm going to call up all my other doctor friends so we can stop poisoning the public. Okay, it's a fantasy. I might get that call someday. Okay, so what do you do if you are iodine deficient or poisoned? Take some iodine. Okay, high dose vitamin C, unrefined sea salts, and this has to do with getting rid of the fluoride and chlorine and the toxic halides that you've been exposed to, sweating in an infrared sauna. Eat seaweed. It's fantastic, but make sure it's from a clean source. You don't want to get Japanese seaweed harvested close to Fukushima. I know what you're thinking, but it glows in the dark and it's easier to find. I know. Gosh, there's a funny guy in every crowd. Okay, vitamin D, you need this stuff. I mean, vitamin D deficiency is associated with almost every cancer, every skeletal disorder, every digestion. And plus, if you put the sunblock on, it gets into your skin and it is an endocrine disruptor. Isn't that interesting? Okay, so you need sunlight exposure. We're coming into our summertime now. Southern hemisphere is coming into their winter time. You got to supplement. If you're not supplementing with this, then you got to get exposure. You need vitamin D and K2 to work together, so look at fermented foods, certain cheeses, healthy animal products. But man, you gotta limit the animal product sources because if we grow too many animals, it's bad for the planet. And right now, the concentrated feeding organizations, they are literally killing our planet and torturing animals. It's not a healthy way to eat. But I had a patient that brought me cheese from 8,000 feet? 6,000 feet, okay, up in Switzerland, and she saw the cows that they milked to produce the cheese. That was pretty cool. She walked on the grass that the cows ate that produced the cheese. So that, that's a whole different world. Now, magnesium, this is one of the minerals that most everyone is deficient in. This one is one of the most vital ones. So obviously no toxic exposure, but if you're magnesium deficient, see, I want you to get the idea that magnesium, you need this in order to have that tissue communication. That depression, anxiety, and panic attacks aren't because there's some weird thing wrong with you. It's from deficiency or toxicity. It's a long-term poisoning. It can be the frontal lobe dysfunction because the frontal lobe is in anxiety and stress and depression. This is where neurotoxins affect the frontal lobe. That's impulse control. What do you think most kids have? Impulse control issue. Why? Because the vaccines are negatively affecting the frontal lobe. But magnesium deficiency does the same thing. Osteoporosis. Was this gal with osteoporosis said, wow, we really need to look at your diet intake. Do you have magnesium deficiency? No, it'd be nice if they do. Besides, these are the sources of magnesium. Yeah, I'm thinking dark chocolate covered dried fruit with bananas on the side. Anyone? Avocado with a little bit of sea salt? Oh man, yeah. How many people are fasting today? Okay, good. Doesn't this look good? I know. Okay, and then breathing. I'm talking the simplest basic things. Breathing in through the nose, that bronchodilates. It makes it easier to allow that to function. Okay, you get nitrous oxide in there. It's better for your immune system. It doesn't lower your blood pressure. It allows your blood to be more effective at its job. Blood pressure is only going to elevate if the blood pressure isn't efficient at doing its job. I'm getting more oxygen transfer. It works better. Exercise every day. Why? Because this is how your body adapts. And then you got the emotional stress. We have always had physical, chemical, and emotional stress since time immemorial. Always, for millennia. Only now we're being confused by an ignorant population to say, no, all of a sudden you're getting these diseases that were never in existence before. It can't be from the environment. It can't be from toxicity. It can't be because your brain and body can't communicate. It's just bad luck or bad genes. That's criminal. Emotional stress, so many ways that you can deal with emotional stress. One of our doctors today has only been with us 7 months, and it takes us about 4 months to train one. And he said, Doc, this is amazing, because we go through a nutrition report and we talk about deep sleep, we talk about neurolinguistic programming, how to reprogram it, we talk about dealing effectively with the physical, chemical, and emotional stressors. Now, this guy's worked at 3 other offices, and he said, nobody does this. And I'm going, why? You have to. If you have somebody with a phenomenal nervous system, but they eat like hell and they can't sleep and they're depressed, are they healthy? It's impossible. You get somebody with a distorted spine, but they have great relationships, okay, and they have a good diet. Are they going to be healthy? No, it's impossible. Okay, if they have great relationships, great spine, but they're chemically assaulted, are they healthy? No, you got to deal effectively to reverse disease, physical, chemical, and emotional stress. You have to. And this is why we do this in the end of every talk. You need appropriate nerve supply. You need to get regular exercise. If man makes it, you don't eat it. Look at what you're consuming. If it's soaked in glyphosates or pesticides, that's poisonous food. Sufficient rest. We tell our patients, man, we're going to turn you into a professional sleeper. Your spouse, the person that you're sleeping with, they're going to be envious of you. You're going to be asleep. Your head hits that pillow, you're going to be out like a light. And then people get, really? Really? Yeah. 5 days, baby, we're going to knock you out. You're going to be sleeping professionally. And then we teach people how to master your emotional state. It's so simple, and that's why we've got hundreds of videos, and it's all on this stuff. So it's not just our patients. Every doctor should learn it. Every patient should learn it. Does that make sense? And I'd recommend everyone going to extremehealthchallenge.com or an Extreme Health Academy. This month was all on hormones. Last month, what was it on, Michael? Huh? Digestion. Thanks. Next month's on immune system. Okay, so we're going to have 14-day challenge. It's going to start on June 1st, and it's going to be on how to strengthen the immune system. So we're building this up, okay, and I think the month after it might be on cancers. We're going to build this up to where you are confident with how your body adapts to the environment. You're going to be confident that, what do I do for the cold? Okay, build it. Build your fever, get warm, take some vitamins and supplements. What do I do for this stuffy nose? Get some spicy cayenne pepper, get some water, hydrate it, thin that mucus so your mucus is doing its really efficient job. We're going to talk about everything on how the immune system responds. And we had a really cool webinar this Sunday, and it's just fun. We only have 11 months before we go to Cuba. I know, doesn't that sound like fun? Okay, we only got like 75 cabins, so I would, even though it's like almost a year in advance, I would definitely reserve it. You can go to our website and get information on it, drjohnbergman.com. Oh, and also, we're going to put references on top of references on top of references on top of references on top of references. You know what this is for? Trolls! Eat my references. Okay. Any questions? Questions? Now, I got the only microphone, so if you can keep it clear and concise and nice. Yes, ma'am.
Do you like sardines in a can? The can.
Do I like sardines in a can? Yes.
Are they good?
They are good, but here's the caveat. You got to make sure the can's not lined with BPA. So look for more like Portuguese or wild caught. There's some natural brands that are not with a BPA line can, but they've been canning sardines forever, and that's a really good source of omega-3s, and it's fantastic for long-term storage for for food stuff, because everybody should have at least a 90-day supply of food. Dehydrated organic sprouts and all of that, and sardines are one really good one that has a long shelf life. Yes, ma'am.
What was the thing you mentioned earlier about if women were like mothers, like our mothers or previous generations were exposed to this particular, was a word, I don't remember what it was.
Okay, what did I mention when I was first started talking about the estrogen that was produced in 1938 that our mothers were exposed to?
Right, it wasn't estrogen, it was some particular word.
DES.
The Pitocin.
Pitocin, is that
Yeah,
it?
that's the.
Pitocin. Oh, Pitocin. Pitocin is a hormone that's injected into a mother to stimulate uterine contractions, because obviously women haven't been giving birth for a while. Okay, and when you're in a hospital setting and your legs are up in stirrups and you're restricted to move, and then they put a baby monitor on you, which is like, just scares the hell out of you. And the doctor who came up with this calculation that, yes, you're going to be delivering on July 1st at 12 o'clock, and July 2nd comes and you go in this panic, and you say, "What doctor? I'm late." It's just foolishness. And that's why America is 77th on the list of infant mortality rate, and maternal mortality rate is at epidemic proportion. For every one woman that dies, 10 come close to dying. So this is the sickest society the world's ever seen. It's safer to give birth in El Salvador and Croatia than it is in America. 77th, that means 76 countries have a better survival rate of children because what we're doing is negatively affecting the birth. Big time. Yes, sir.
Can you tell us how to support our amygdala and hypothalamus?
Oh, how to support the how would we support the amygdala and hypothalamus? Send them love every day, baby. Honestly, do everything that we're supposed to do. And it sounds kind of weird because we're trained in that reductionist thinking. that the body is a collection of parts, so that we can actually have an endocrinologist who's completely ignorant of the neurology, who's both completely ignorant of the digestive aspect, who none of them have a clue at what the liver does or the cardiovascular does. You know what I mean? So, but that allopathetic mindset has translated over into naturopathy, you know, where there's a reaction. So you don't do anything to take care of the hypothalamus or the amygdala as if they were separate. Okay, what you do, look at effectively at your life, at the physical, chemical, emotional stress. Make sure that you have a healthy nervous system, because that's going to help the hypothalamus respond correctly if you're getting the correct signals. Make sure that you move your body every day to stimulate both halves of the brain, which are supportive of those structures. Make sure that you eat only healthy, organic, plant-based foods, and if you eat animal products once a week to once a month, but they have to be healthy animals. Make sure that every night you get in that parasympathetic state of deep sleep so that your amygdala can balance out the hormones and really be aware of the stress response. And let's say you do prayer and meditation, which actually balances out your psyche and helps that emotional aspect. Oh, that. I know, isn't that cool? It's it. You don't need to worry. What do you do for a healthy thyroid? Okay, you got to get a healthy nervous system. Make sure you're not in an adrenal dominant state. What do you do for a healthy gallbladder? You got to get a healthy nervous system, okay, to make sure that you're not producing the stress hormones, which are filtered by the spleen, concentrated by the gallbladder, okay, which stores and concentrates bile, which is superfiltrated blood. So gallstones are coming from chronic stress. I mean, all of this stuff. It's not separate. Does that make sense? Yes, ma'am.
What about natural progesterone? What do you think of taking that?
What about natural progesterone? Oh, hun, take it every day. Yep, my adrenal glands making it right now. Is that what you're talking about? Or are you talking about natural progesterone that you're going to get in a cream and put it on you that says bioidentical, even though it's not bioavailable 100% and it's not identical? Oh, that stuff. Okay. I don't know. Try it on your cat and see if she can develop tumors later.
I'm cast this myself, of course, a long time.
Okay, remember, I have the only microphone,
Right.
so I'm looking for clear, concise.
Right.
Okay, now, think of this. If you've had organs removed, because that's very popular now, we now know that removing tonsils was completely ineffective. People are having hysterectomies, okay, because they just don't want to have any dealing with something. I mean, you can't imagine how many parts are being removed. The adrenal glands can take over, okay, but you got to make sure that you're not toxifying the system. If you're putting a cream on your system, unless you've had organ systems removed, there's a risk-benefit ratio there, where the risk is in interrupting normal cell communication, and the end result of that is disease. The benefit is maybe it will help you adapt from the loss of organ systems. And this is not a benign procedure. It's very, very dangerous. That has to be looked at with the risk and benefit. Bioidentical doesn't exist. Your body produces it. If you got adrenal glands, it's producing it right now at the right time and the right dosage based on your environmental stimulus. Does that make sense? Good. Any questions? Thank you for making it clear and concise. Yes, sir.
Crash course in how to become a professional sleeper. The 4 things I have to remember.
Crash course on how to become a professional sleeper.
Right.
Watch our video. Watch our videos. Okay. Oh, did you say 4 words or less, or 4 things? No, you got the trick is to reset your circadian rhythms. Optimal human function is 6.5 to 7.5 hours. There's high disease rates at 5 hours or less, or 9 hours or greater. So what you're going to do is journal before bed, the quiet and overactive mind. You're going to read before bed, a paper book. Electronic devices interrupt melatonin production. And then you're going to wear nightshades, because the way our species works is every 90 minutes after a REM state of sleep, your eyes open up. If you're living in a noisy area, you got to get a white noise machine. Okay, so it can have your brain to train in. You go to bed at 10 to 10:30, and then you restrict your sleep to 6 hours for about 21 days. No naps or anything else. So within 5 days, you're going to be sleeping through the night. Within 21 days, you have reset your circadian rhythms. Then you can start getting, instead of 6 hours of sleep, you're going to get 6.5 to 7.5 hours of sleep, and then you've completed that. If you travel a lot, that is also a really cool way to eliminate jet lag in a day.
So, no radio in the background, no music, nothing.
White noise machine if you live in a noisy area. Yes, ma'am.
Cod liver oil, good or bad?
Cod liver oil, good or bad? It's actually really good because it's one of the low metal oils. Look for more anchovy, mackerel, and sardine. It's kind of a bummer that they dumped a bunch of nuclear waste inside of the Atlantic, so we're starting to see some of the fish negatively respond to that. But so far what I've seen, it's good. Yes, ma'am.
You said not to drink water half hour before, during, or after eating. So if you're not juicing, what do you take your vitamins and supplements for?
Oh, I said to not drink water a half hour before a meal, during a meal, or a half hour after. That's because you don't want to dilute the stomach acid, and that'll loosen up the lower esophageal sphincter and decrease your body's ability to break proteins to amino acids. So what do you take your vitamins or supplements with? You can take a little bit, like coffee, tea, wine, beer, juice, water. But you got to figure, if you're taking enough to drop a couple of enzymes in you, that's not going to dilute the acid a whole bunch, and you're going to be eating it with food. I'm talking about lots of water to dilute the stomach acid. Okay? Yes, ma'am.
If you, as a young lady, have been told that you have the BRCA2 gene,
Yes.
how can you go forward with your life?
Okay, if you, as a young lady, been told that you have the BRCA gene, how can you go forward with your life? Learn about genetic and genetic expression. So throw the fear in the trash can, get educated, and know that you have a ton of relatives going back from time immemorial that have also had this gene that haven't expressed it in cancer. Okay, so it's the same thing as HLA-B27. It's the same thing as all the MTHFR gene. It's all of those. There's a difference between having the gene and expressing it. Radical different world. So start looking at all the relatives that you've had for millennia that never developed any cancers, and look at the difference on expression and suppression.
Is there a diet? Obviously follow this plan, right?
Honest to goodness, just follow. You got to just eat normal. Don't take poisons. Look at the physical, chemical, and emotional stress load, and you'll be okay. Yes, ma'am.
Where do you find fruits and vegetables that have not been watered with water that contains fluoride?
Oh, good luck with that one. Good luck with that one. Yeah, where do you find fruits and vegetables that have been watered without water containing fluoride? Good luck. Hawaii, maybe, Ecuador, certain parts of the world. Yes, ma'am.
In your own garden, if you filter yours, you said you have an awesome garden. Do you have a device to filter yours?
Oh, I said that I used to have a garden. I did. I don't have a garden anymore.
Okay.
Now I live mainly on a boat, and there's no garden. Okay, so next week, immune system. Thank you very much.